Okay, our patient here today is pretty fair skin, so she's probably a type 2 to 3 Fitzpatrick skin scale phototype. In terms of textural irregularities, we're talking more about widened pores over the nose, over the middle part of the face, so we can all treat that using the pick away device that we have here. We're going to treat the freckles. I'm going to do spot treatment to some of the select freckles. I'm going to use a 532 nanometer wavelength to treat on her skin because she's quite fair skin type, so she's suitable for that. And we're just going to start firing now. So that's one spot, and then we just move on. Is that okay? Good. Sometimes I do one pass, sometimes I might do two passes depending on the pigment, but I'm just using a small spot size of 3mm because the pigment is really small as well. Sometimes we also use a cooling device if the patient is a little bit more uncomfortable, and then that helps to make the skin more comfortable as well. I get her to move over to this side. A little bit of larger pigment as well, but mostly all freckles. With regards to lasers, typically once I select the wavelength and the parameters, I typically will go on the slightly lower end of the fluence and I adjust it upwards based on the response. I'm switching to a Resolve handpiece, very unique for this device. This is a 1064 nanometer Resolve handpiece. It allows us to fractionate the beam into many small little beamlets. So that's sort of what you call a fractionated laser. Very similar to what we call a fractional carbon dioxide laser, which you may have heard of before, that's used usually for scars and textural irregularities. Now in this case, the Resolve handpiece will fragment that single pico beam into very small little pico beamlets. And that basically allows us to remodel the dermis, or which is called the second layer of the skin, without breaking the top layer of the skin. I'm just going to focus on the pores and the sort of texture in the middle of the face where she has most of her problems. That's very common in a lot of women as well in Asia, but they always come complaining about the widened pores around the mid cheeks as well as the nose. I typically will do maybe 3 to 4 passes in the same area. I go in different directions to achieve that as well. And then I have to turn this way for me. I stretch the skin a little bit. So in older patients, it's really good for texture like fine lines and wrinkles. I like to use different modalities in the same patient, sometimes to get optimal outcomes. We mix the modalities. In this case, we're just using this. She's got very good skin, she's young, so we don't really have to mix too much modalities for her. So actually this is a very comfortable treatment, so absolutely after this you may expect some warmth or some redness on the skin. Usually for most people it goes away within an hour, sometimes up to 3 to 4 hours, so you can absolutely go back to work. It's in a way a lunchtime procedure, but not one that has no downtime and diminishing returns. It absolutely works very well for texture, pigment. It just doesn't break the skin. All the work or the damage is done deep to allow remodeling to happen. So she can put on her sunscreen, put on some makeup, go back to work, and nobody will know that something was done the same day. Now, with regards to the single spots that we've treated earlier on over the freckles, again, the endpoint that we want to expect is not the typical sort of greyish-white colour that we get with the older lasers. When we treat the spots, what I want to see is really just some redness, and that is enough. That is enough energy delivered to allow us to have a good response.